Good day, everybody. I am Dr. Arvind from the Department of Microbiology, and I'll be briefly discussing about the microbiological aspects of viral hepatitis. And at the end of the session, you'll be able to describe the characteristics and epidemiology of viral hepatitis, discuss the viral markers in the evolution of hepatitis, and know the modalities in the lab diagnosis of viral hepatitis. Hepatitis is basically inflammation of liver, which is caused by toxins, medications, alcohol, bacterial and viral infection. Viruses such as A, B, C, D, and E are major types. Around 2.3 billion people are affected, and 1.4 million death is due to hepatitis. The major viral types, as I said, are hepatitis A, B, C, D, and E, which we will be briefly discussing today. And other minor causes include cytomegalovirus, Epstein-Barr virus, herpes simplex virus, and varicella zoster virus, which is seen in immunocompromised states. The symptoms of liver damage is also responsible for other manifestations like jaundice, splenomegaly, pancreatitis, gastritis, diarrhea, testicular atrophy, arthritis, and myopathy. Hepatitis A virus, if you see, it is a RNA virus under the Picornaviridae family, which has a single-stranded RNA, non-enveloped, and a icosahedral symmetric capsid. It is transmitted by fecal-oral route, and only one serotype is there with 7 genotypes. It can cause an acute infection which can be self-limited, and developing countries with poor sanitation and international travelers to endemic area report hepatitis A. Humans are the host for hepatitis A virus. Incubation period is around 15 to 45 days. Children and adolescents are the most common age group affected, with 95% remaining subclinical. Adults are more icteric, and outbreaks are common in summer camps, daycare center, families, institution, neonatal ICUs, and among military troops. And food sources include drinking water, milk, or food such as raw vegetables, salads, frozen strawberries, green onions, and shellfish. The largest epidemic was reported from Shanghai in 1988. If you see hepatitis B virus, it comes under Hepatnaviridae family. It is the only DNA virus among hepatitis viruses. And electron microscopically, we can appreciate three particles. Most frequent particles are spherical forms, followed by tubular forms or filamentous forms, and complete form known as Dane particles, which is a 42 nanometer sized particle. And there is an outer surface in this particle, which is an envelope, which is known as the hepatitis B surface antigen. The inner nucleocapsid is composed of hepatitis B core antigen HBcAg and the pre-core antigen HBeAg, which is the marker for infectivity. And there is a partially double-stranded DNA. The partial double-stranded DNA has 4 overlapping open reading frames such as C, S, P, and X. The C codes for the HBV E antigen and the core protein. S gene codes for the hepatitis B surface antigen. The polymerase gene overlaps the S gene and codes for the polymerase enzyme. The X gene encodes the hepatitis B X antigen, which is involved in the gene expression and pathogenesis of chronic liver disease and hepatocellular carcinoma. This is a schematic of HBV virus with a partial double-stranded DNA surrounded by a protein capsid or the core antigen, which is further enclosed by a surface antigen or the envelope. There are certain non-particulate proteins known as HBx antigen. HBsAg is previously known as Australia antigen, and it is antigenically complex, which contains two components, a group reactive component known as A epitope and a type specific antigen D, Y, or WR. 4 subdeterminants can be formed such as ADW, AYW, ADR, and AYR. There are 10 genotypes, among which A and D are prevalent in India. They can be transmitted by parenteral route, by blood and blood products, sexual transmission, vertical transmission from mother to baby, and direct skin contact through minor cuts. The prevalence of HBV is based on the HBsAg carrier rates. There are three types: type 1 pattern, which is low endemicity; type 2 pattern, which is intermediate endemicity, where the carrier rate is around 2 to 8%. It is observed in India. Type 3 pattern is seen in high endemicity. India comes under type 2 pattern. 40 million HPV carriers are there. 11% of the estimated global burden is seen in India. Highest prevalence is seen in Andamans and Arunachal Pradesh and tribal areas. HPV accounts for around 40 to 50% of hepatocellular carcinoma and 10 to 20% of cirrhosis in India. The onset is slow and insidious when you see HBV, and the chance of developing chronic hepatitis or carrier state is inversely related to the age. So in perinatal age group, around 80 to 90% of perinatal infection can lead to chronic infection. There are certain markers, as I said. The first marker to rise is HBsAg and HBeAg. Later, we can demonstrate anti-HBc antibodies as well as anti-HBs and anti-HBe antibodies. High-risk groups include surgeons, paramedical workers, sex workers, recipients of blood transfusion, hemodialysis patients, drug addicts, and travel to endemic areas. The general preventive measures include screening of blood bags, organ donors, safe sex practices, safe injection practices, safe aseptic surgical practices, health education. If you see hepatitis C virus, it comes under Flaviviridae family. It is a spherical virus which is having a positive sense single-stranded RNA and an envelope. There are many structural and non-structural genes in the HCV genome. One serotype and 7 major genotypes are there, and more than 100 subtypes are present. The extensive genetic variability in the E2 envelope region is responsible for the challenge which we get to design a vaccine for hepatitis C virus. The markers of HCV include HCV RNA, which is seen all through the infection, even in chronic state like cirrhosis and hepatocellular carcinoma. Anti-HCV antibodies can be demonstrated in acute and past infection. The most common region affected is Eastern Mediterranean region, and worldwide, if you see, genotype 1 is the most common genotype. There are other genotypes in various other regions. For example, genotype 3 is seen in South Asia, Australia, and Europe. If you see hepatitis D virus, it comes under Delta viridae. It is an RNA virus. It is a defective or incomplete virus which cannot survive without the presence of hepatitis B. Hepatitis D is a circular negative sense single-stranded RNA, and the protein code is made up of a single protein called as hepatitis D antigen, which is surrounded by an envelope protein derived from HBsAg. Okay, the transmission is similar to hepatitis B and hepatitis C. Okay, if you see, there is an RNA genome which is circular, which is surrounded by hepatitis B surface antigen. Hepatitis E, it is enterically transmitted hepatitis, non-A, non-B hepatitis. Transmitted by fecal-oral route, zoonotic transmission is also seen, and blood products can also transmit hepatitis E virus. It comes under hepiviridae group. It is a RNA virus and has a specific antigen known as HEV antigen. There is only one serotype and 5 genotypes. Genotype 3 and 4 are more attenuated and account for subclinical infections. If you see the lab diagnosis, hepatitis A virus, stool sample, blood sample, bile and liver biopsy serum can be collected. ELISA is the test of choice in serology, and PCR for detecting RNA. Similarly, hepatitis B, PCR for detecting DNA. ELISA can be done for antigen and antibody detection in blood sample. Hepatitis C, similarly, PCR for detection of RNA and ELISA for antigen and antibody in blood sample. Hepatitis D, PCR for detecting RNA and ELISA for hepatitis B surface antigen and anti-HDV IgM antibody. Hepatitis E virus, PCR for RNA and IgM and IgG antibodies by serology. So this is a summary of all the viruses. As you can see, I have highlighted important points, important differences between the viruses. So you see, the only DNA virus is hepatitis B virus, and two viruses which are transmitted by fecal-oral route are HAV and HEV. The clinical outcome of infection, if you see, HAV and HEV can be self-limited, whereas HBV, CV, and DV can cause chronic infection. Hepatocellular carcinoma is seen in hepatitis B virus and hepatitis C virus. The percent of viral hepatitis, if you compare all the five, 50% of infection is due to hepatitis A virus, and there is no carrier state in hepatitis A virus, whereas we can appreciate carrier state in hepatitis B, hepatitis C, and hepatitis D virus. These are my references. Thank you very much for your kind attention.